everyone to our educational series, Aware and Care, which was created by our friends at the Parkinsons Foundation. Before we get started, we're first so glad that you are here, and we encourage you to use our simple Zoom features at the bottom of your screen to interact with us. If you have any questions or comments, you can use the Q&A feature icon. And then when the presentation is completed, you'll also have the option to raise your hand if you would prefer to verbally ask your question. If you have any other technical questions, feel free to use the chat feature. It acts like an email, allowing you to contact us with any IT issues that you may experience. So today, Marcie Salamone is our speaker. She is both a DAPS board member and a Parkinson Foundation ambassador, and a volunteer for several local associations that include her church and the Richardson schools. Marcie was diagnosed with Parkinson's in 2017. Is that correct, Marcie?
Yes.
Okay, and since then, she has become an active advocate for the PD community. She has a very robust background as an attorney and as a CPA, which makes her such an incredible asset and a integral to the DAPS community. So thank you so much, Marcie, for taking the time to present the Aware and Care kit to the DAPS community.
Well, thank you for your kind introduction. I appreciate it. And thanks for allowing me to be here today to make this presentation. I'm going to warn you that there are a lot of lawn care companies outside my house right now. So if it gets loud, I apologize up front. Before I start with the Aware and Care program the presentation, Leisha had asked me just to talk about a little bit about my COVID journey this year, which kind of ties into Aware and Care and why it's important. Back in March, my husband, my daughter, and myself went to New York City to visit law schools because she's a senior in college and planning on attending law school. And my husband and I, to be honest, graduated from Fordham Law School in New York City. Of course, she was least interested in that one. But we were there in March. We came home. I got sick. I had a fever. I had a dry cough. I could not smell. I could not taste. About a week later, it blew up in New York City in that metropolitan area. So in October, on October 22nd, I was on a Zoom call with my church missions committee, as I serve on that committee. And I started to get achy and have the chills and just not feel good. And from there, for the next 3 weeks, almost every day, I seemed to feel worse. I thought I had the flu. By the 31st, Halloween, that morning, I said to my husband, I have got to go to the doctor. I'm getting worse every single day. I went to the doctor. They did a flu test. I did not have the flu. They did blood work. My white blood cell count was quite low, but everything else seemed normal. And she said, I know you've already had COVID, and I know you're careful. You wear a mask, you use hand sanitizer and everything. I'm going to give you a COVID test. And sure enough, I had it again. And I do all the things I'm supposed to do, and I got it again. Now, I may have gotten it while I was volunteering at a food bank, where I was wearing a mask and using hand sanitizer. The symptoms were quite different the second time. Every bone, every joint, every muscle ached. I had a headache for days and days and days. I was nauseous all the time. I couldn't eat. I had dry heaves. I could barely walk. To be honest, there were times my husband had to help me get out of bed to use the restroom. So I would just caution everybody to be very careful. Even if you're being very careful, you can get it anyway, as I did, and this is the second time now. So as a segue into the Aware and Care, fortunately, my lungs stayed clear. I never ended up having to go to the hospital, thank goodness. But I easily could have. And the doctor told me, if your lungs start to hurt or there's pressure on them, get yourself to the hospital immediately. Fortunately, that did not occur. Fortunately, I don't have underlying symptoms. I know I have Parkinson's disease, but mine is not that far along yet where it would be a complication with COVID. And overall, I'm healthy and young enough, I guess, too. So I was lucky that did not occur, but I can tell you it was a brutal 3 weeks. So as a segue again into the aware care, that's why it's important to always be ready to go to the hospital with Parkinson's, because you just don't know what could happen. So as we progress through the presentation, I'll explain more what an aware and care ambassador does for the Parkinson's Foundation. First of all, why are we here today? And we're here today to help people affected by Parkinson's understand the risks associated with hospital stays, get the tools they need to play an active role in their care, be prepared for a hospital visit, whether planned or unplanned, and develop strategies, to get the best possible care in the hospital, to be aware and care. And most of us, if we're going to the hospital, our general thought is hospitals are safe, right? They're trying to help me, so they must be safe. So many of us with Parkinson's will first off think to ourselves, well, they'll call my neurologist. And that may be true if you're there for something related to your Parkinson's disease. But if you're there because you broke your leg or you have COVID or you had a heart attack, they may not call your neurologist. The pharmacy will have my PD meds, excuse me. Well, they may or may not have your PD meds. It's just whatever's in the pharmacy. Staff will understand PD symptoms. Some of them may, some of them may not. They estimate that there's about 1 million people or so in the United States with Parkinson's disease. Now, 1 million may sound like a lot, but if you look at the overall population of the US, it's really not that high. So the staff may be great. They may be great doctors, great nurses, but it may not be something they run into that often. And they simply don't know what they don't know. They will bring me my meds on time. Well, most hospitals, the way they distribute medication is really on their own schedule. So they may have it set up, they do it morning, afternoon, and evening. And many Parkinson's patients, that's not how they take their meds. So you may or may not get them on time. And they will know the drugs that are unsafe, unless the fact that you have Parkinson's disease is put into the electronic chart. They may not even be checking whether those drugs are unsafe or not. Inpatient care of people with Parkinson's. Compared to control cohorts, PD patients have higher rates of hospitalization. They are hospitalized 44% more than their peers without Parkinson's. When they go into the hospital, it's for a longer duration, by up to 2 to 14 days, depending upon the study. PD patients have avoidable complications that are higher than for their peers without Parkinson's disease. And unfortunately, PD patients are less likely to be sent home after hospitalization. On average, only 33.2% are discharged to their home. 62.9% are discharged to a facility. And unfortunately, 3.9% resulted in inpatient mortality. Imagine 12 people with Parkinson's. So there they are lined up. 4 of them will be hospitalized this year. Of those 4, 3 won't get the right medicine on time while they're in the hospital. And of those 3, 2 will have complications as a result of not getting that medicine on time. So 2 of every 12 people with Parkinson's, or 1 in every 6, will have avoidable complications because the hospital doesn't understand their needs. And again, it may be a great hospital, it may be great doctors and great nurses, but sometimes people don't know what they don't know, and that causes problems. Medication changes, and it's MODS, MODS for missed, omitted, delayed, or substituted. The first one, missed. Medications are missed entirely by error, often because PD is not mentioned or listed in the electronic medical record if the presenting issue is not explicitly and directly related to PD. And that's what I said earlier. If it's you went in because you had a heart attack, or you broke a leg, or you have COVID, those don't necessarily have anything to do with Parkinson's. So it may not be listed, and so you may not get your meds. They may be missed. Omitted. Medication is withheld intentionally when a clinician incorrectly assumes that NPO indicates that PD medications should also be omitted, and that severe difficulty with swallowing justifies the omission of the medication. The NPO means nothing by mouth, basically. I guess it's in Latin, that's why it's NPO. But if that's on the chart as nothing by mouth, they will not allow you to have your PD medication, which obviously for Parkinson's patients could cause all sorts of complications. Your medicines may be delayed. Medications are not distributed precisely at the home schedule, but rather follow the standard 1-hour window and/or were set to the hospital standard distribution schedule. So many PD patients cannot just have them within some 1-hour window. It'll make their symptoms that much worse. Or just at the standard distribution schedule, which may be morning, afternoon, and evening. And then in addition, your medications may be substituted. Distribution of medication other than the exact medication that you're taking may not be given to you because it's not available in their pharmacy. So instead of immediate release, they may give you continuous, or instead of the name brand, they may give you generic. And all of those things may cause great complications for people with Parkinson's disease. Anti-Parkinson medications are as necessary to a Parkinson's patient as insulin is to a diabetic. Often PD medication schedules are changed in the hospital. This change may result in greater risk for disability and consequently an increased risk of accidents and other complications. The acute discontinuation of PD medications can be life-threatening. Why is this happening? Seemingly minor errors by anyone providing care can mean a crisis for people with PD entering the hospital. And again, all of these people, whether it's the surgeon, a social worker, what have you, may be great at their jobs, but sometimes people just don't know what they don't know, and that causes harm to somebody with Parkinson's disease. So if it's a planned admission, you may have your Parkinson's disease doctor involved and unit nurses involved. If it's an emergency admission, it may be first responders, it may be ER nurses and ER physicians. And then of course, all the other ones around there are things like anesthesiologists, pharmacists, doctors, nurses, what have you. But they may make an error because they simply don't understand what a person with Parkinson's needs, and that can cause a crisis for somebody who's in the hospital with Parkinson's. Why is this happening? Lack of awareness of the critical importance of Parkinson's medication timing. Again, many just may not have any idea how important that timing is to people with PD. Lack of awareness that poorly managed Parkinson's might result in mental confusion and other serious symptoms. Lack of awareness that many common medications for pain, nausea, depression, and psychosis are unsafe for people with Parkinson's. For instance, when I went to the doctor, it turned out I had COVID, I did not think I had COVID, but I did. I made a point of telling them immediately that I have Parkinson's disease. Now, I don't take a lot of meds. I take Rizagiline, 1 pill a day right before bed. However, there are still many drugs that they might have given me, like anti-nausea drugs, that will not mix well with the Rizagiline. So they did find me an anti-nausea drug that was not a problem. Now, I'll be honest with you, it didn't work very well. My husband ended up finding Dramamine Naturals, and that worked great. So, but even that, we checked online and made sure it did not react badly with the razagiline. So even in the best hospitals, even when treated by centers of excellence, unless we intervene. So all of those things can happen even in the best hospitals. And the centers of excellence, there's, I think, about 52 of them around the world, many of them in the United States, that are designated by the Parkinson's Foundation as centers of excellence for their care with Parkinson's. But these things are even happening there. So it's important that we as patients and caregivers intervene to try to make sure that the lack of awareness does not cause problems down the road. The solution: every care provider must prioritize the involvement of the primary PD care provider. So finding this person and not assuming that the hospital is going to contact your movement disorder specialist or neurologist. They need to be notified that you are in the hospital. Value the knowledge of the person with Parkinson's and the family care partner. The person with Parkinson's and the family care partner know more about you and how the Parkinson's is impacting you than anybody else, more than your neurologist, more than your physical therapist, more than anybody. So it's important to get the hospital to listen to you and to pay attention to what you and your care partner are saying. Understand and utilize the recommendations within the Aware and Care materials. And that's this right here. And we're going to talk about what those entail. So with those three things here, that can ensure to help all of these other in blue to become more aware of what they should be doing, and so that they do know, and that there's not that you don't know what you don't know. They will understand and hopefully make adjustments to that. Always remember, each person with PD has a unique combination of medications and listed regimen. Each person with PD has the best knowledge of their disease and other conditions, but may have communications challenges. And for instance, when I went to see the doctor about COVID, my husband drove me there because there was no way I could even drive there. I did go back by myself. I don't have communication challenges at the moment. Someday I may. He would then have to take over to say, she has PD, this is her meds, she can't take certain things. So it's important to either be able to say that yourself or to have somebody else say that for you. Care partners can have all of the above information and advocate for the person with PD. And the Aware and Care materials should be used from admission through discharge to ensure best practices are followed. Aware and Care is here to help. The Parkinson's Foundation's Aware and Care campaign can help everyone be better informed. The person with Parkinson's, the care partner and family, healthcare providers, and hospital and facility staff. The Aware and Care kit helps patients and families plan for a hospital visit and advocate for the best possible care during the stay. And when we went through the training to be ambassadors, there's about 100 across the United States that are Aware and Care ambassadors for the Parkinson's Foundation. I can tell you, again, I take 1 pill a day of razagiline, and that's all I take right now. That was not true for some of the ambassadors. And the ambassadors can be people with PD. Some of them are caregivers. Some of them are healthcare professionals or in that field anyway. So there's a wide array of people, but there were a few people who have Parkinson's disease and have been admitted to the hospital and shared some of their stories, and they had a rough go. So it's important to be prepared and do all you can to hopefully minimize those complications for yourself. The Parkinson's Foundation has a helpline, which people can call to ask all sorts of questions or to get referrals or anything that people might need when they find out they have Parkinson's disease. And these are just two of the things that people have said when they have called that hotline. The doctor was about to give me Aldol. I said I looked it up in my kit and it's not appropriate for people with PD. And then somebody else said, this was my first time at a hospital when a nurse was aware of the importance of meds being on time for Parkinson's patients. And as I said, some of the people who shared during our training are Parkinson's patients and had horror stories with being in the hospital that they did not get their meds on time and it caused serious problems for them. Whoops. Let me see, did that go to? Okay. So there's 3 ways to access the free information, the Aware and Care information. One, you can download it online and you can access all the printable resources online for their own use without cost. So if you go to the Parkinsons Foundation website, you can find some of these materials that you can just print off and use. There's no charge for that. There's an Aware and Care packet, which you can order online, or if you call the helpline, you can order it through them as well. And there'll be no shipping charge with that. And we'll break down the remaining slides will break down what's in each of these. And then there's also an Aware and Care kit, which I don't know how much you can see that because I'm sharing the screen with the PowerPoint, but there's a whole kit. And this you can order online. It is free, except they do charge $8 because it costs them that to ship it. However, it can also be distributed by centers of excellence if the hospital is designated as a center of excellence, or from Parkinson's Foundation staff and volunteers at no charge. So I do have a bunch of these, and if you are within the Dallas Metroplex and are interested and I can get it to your house readily, I can deliver this to you for free. But if you're like in Oklahoma, no. You'd have to live in the Dallas Metroplex. So you can see there is, if you want to download or order kit materials, you can visit parkinson.org/awareandcare. Oops, I think that went too far. The first thing in the kit are fact sheets for nurses, and it's tear-off pads, so there's quite a bit of them. And it's just the ability to share vital information about Parkinson's with the members of your care team. And again, this is not a dig at nurses. Many of them are excellent nurses, but they may just not know much about Parkinson's. They may have not had many patients with Parkinson's. It's not something that they deal with on a daily basis. So it may simply just not being aware, that's all. It's not that they're bad nurses. It highlights critical care considerations, medications to avoid and safe alternatives, common PD symptoms, typical PD medications, and info about if you've had DBS or you have the Duopa pump. The fact sheet for nurses you can download and print, so that's free if you just go to the website. It's in the Aware and Care packet, which you can also order online or through the helpline, and that is free. Or it's also in the Aware and Care kit, which if you get it from me, it's free, but I do need all your contact information. Or you can just go online and order it for $8 shipping fee. The next thing in the kit is a medical alert card. And you fill in your card with your emergency contact information and place it in your wallet. I do have mine in my wallet. It obviously has personal information, medications to avoid and safe alternatives, important medical information for healthcare providers. And it also says on the card, I am not intoxicated. Please call my family or physician for help. So depending upon if your PD symptoms are severe, somebody could assume you are intoxicated when you're not. It's just your PD symptoms acting up. This card can be downloaded and printed for free. It's in the Aware and Care packet, which you can order for free. And it is also in the Aware and Care kit. And as I said, I did fill mine out. It is in my wallet. This is a medication form. Complete this form and keep copies in your kit for use at the hospital. And if you go online to download this form, you can actually fill it out on the computer and then print it if you wish. It has personal information as well. You list your medications with dosage, excuse me, frequency, timing, etc. And then if you have any special circumstances, you have DBS, you are confused, you have dementia, you can check those off and write a little blurb about it. Those are available to download and print for free. They are in the Aware and Care packet for free if you choose to order that. And they are also in the Aware and Care kit as well. There is a hospital action plan. It's a booklet. And it can just help you prepare for your next hospital visit, whether it's an emergency or it's planned surgery that you're going in there for. It has 6 steps to optimum care, a checklist for a planned hospital stay, a checklist for an emergency situation, and any special considerations that might be relevant in your case. The hospital action plan you can download and print for free. It is also in the Aware and Care kit, but it is not in the Aware and Care packet. So if you ordered the packet, you'd have to go download and print it as well. Oops, I think I went too far. Yeah. This card is a deep brain stimulation info card. So it says, I filled out Marcie Salamone, do not have a DBS device. If you do have a DBS device, you'd obviously check the do, and then somebody, when you bring the kit to the hospital, they can pull that out and immediately know that you have deep brain stimulation. So it has precautions about DBS, what they would need to know about it, a checklist for an emergency situation, and device-specific safety instructions as well. This is something you can download and print for free, and it is in the Aware and Care kit. It is not in the packet, but again, you could just download and print it. So particularly important if you do have DBS, that they know that you have DBS. This is if you have the DAPS pump. I'm never quite sure how to say that. Again, if you use that pump, you want them to know that you do. So it highlights the 3 components of the therapy, what you need to know about the therapy, and the precautions. I have this in my kit. I just say I do not have that on the top of it. But clearly, if you do, you need to fill this out so that they are aware of that. You can download and print that for free. It is in the Aware and Care kit. It is not if you order the Aware and Care packet, but again, you can just download and print it and then you have it anyway. So that is available as well. And then there's some print only materials that are not included in the kit or the packet. You just have to download and print them. And these are doctor's letters for planned surgery. So it says, feel safer about going into a planned surgery. And this letter would be filled out by your neurologist, movement disorder specialist. So there's 4 versions. For instance, if you don't have DBS, you'd have 1 letter. If you do, you have another. So you can see the 4 versions there. And you can find all of those if you go to parkinsons.org/aware and care, and you click on the resources section, you will find those letters. And that would be something that if you're having planned surgery, you could have a doctor complete. And then there's also a doctor letter for any hospitalization. It says, until the coronavirus crisis is over, we recommend that everyone print the hospitalization during COVID-19 letter and have it signed by their primary Parkinson's care provider. And again, you can download and print these for free online. Unfortunately, one of my cats has decided to join the educational series right now. Okay, if you do get the whole kit, which I'm holding up right now, you do get the bag. There's also a magnet you can see there in the middle. It says, I need my Parkinson's medications on time, every time. And that's there so that there's often a lot of metal in a hospital room so that you can put it on the metal frame to the bed or whatever. And hopefully that makes it quite clear that you need your Parkinson's meds. There's also a Parkinson's disease alert bracelet. that they suggest that you wear all the time. I mean, I'll be perfectly honest with you, I don't wear it all the time. I don't think I need to wear it all the time as of right now. I think there'll be a day that that will change. But what I do is I leave it in my car. So it is in the console right there of my car. If I feel at some point ever I need it, it is right there to keep there. So now these three things are only available in the Aware and Care kit. But if you don't choose to get the kit, you could use another bag. You just wouldn't have the magnet or the bracelet. It says, if you do not have the kit bag, we recommend that you establish a specific bag to hold all the materials and keep several days of each medication in their original and most recent bottles. And we'll talk about that in a little bit about why they say to keep the medications there. When to use Aware and Care materials. For a planned or emergency hospital stay, bring to every physician or consult appointment, pack and bring when you go to the hospital, ask a family member or friend to bring to the ER. Now, when I filled out my kit, we have a basket that's near the door to the garage. So my kit is in there. So if we should ever need it on our way out the door, that's where it is. Annual checkup with your Parkinson's doctor. Bring and share the program with your doctor at your next scheduled appointment. Exposure will help medical professionals become familiar with the materials and special considerations PD patients may need in the hospital. That's kind of the way that you can advocate for other people with Parkinson's, because the more we spread the word, then this becomes more common knowledge, and hopefully some of these problems will slowly disappear. Travel with all medications in original bottles. Keep the original label with the name of the drug and your doctor's name. Bring twice as much medication as you'll need and keep one set in your luggage with the other set in your Aware and Care materials, which should be in a carry-on bag that does not leave your sight. Just in case your luggage gets lost, or you're going to Hawaii and your bags end up in Hong Kong. So you just want to make sure that you have some on you at all time. Extreme weather emergencies. Before a natural disaster, make sure that your bag has a week of medication in original bottles and check that your medication list is up to date. Keep your medical alert card with you at all times and keep your bag handy in case a sudden evacuation is necessary. So, and especially here in the Dallas area, last year around this time, we had a very severe tornado. So you never know when an extreme weather emergency will occur. Aware and Care summary. Aware and Care is a national campaign to prepare and empower people with Parkinson's disease through tools and information to be your own advocate in the hospital setting and to have an engaged partner in your healthcare overall. Educate healthcare providers and staff to help people with Parkinson's get the best possible care while in the hospital or other inpatient setting, whether that's rehab, et cetera, or long-term care facility. And this is what the Aware and Care ambassadors do. The Parkinson's Foundation volunteers are trained to educate the community. So if people with Parkinson's know what they need, they are more likely to get appropriate care. So again, if people with Parkinson's go into the hospital and they make the assumption that their neurologist will be contacted, that they're going to get their meds on time, that they're going to get the meds that they normally take, and that doesn't occur, they could have problems. And then unfortunately, they may have problems communicating or may have cognitive issues where then they can't tell a nurse or a doctor how important it is. So it's important that we're educated going into it so we know how to handle it. Educate clinicians who treat Parkinson's. If clinicians help spread the word about resources, we can share them with more people with Parkinson's. And again, the clinicians may be wonderful clinicians, but sometimes people don't know what they don't know. So the more that we help everybody spread the word, then more and more people understand how this all works and how important those drugs can be to people with Parkinson's disease. Educate hospital staff. If staff know what people with Parkinson's need and why, they are more likely to adjust the care given. And again, hospitals are set up mainly to work the best way hospitals need to work, which makes sense. That's their business, that's what they do. But having a set schedule of maybe giving out meds 3 times a day or what have you will not, it may work for most people, but it won't necessarily work for people with Parkinson's disease. So if anyone has any connection to hospital administrators, please let me know if you're willing to share that information, because the goal for the ambassadors, we want to get in front of hospital staff, because that's where it really needs to be changed. That if those people can make those kind of decisions to change that, it will help Parkinson's patients every single time they're in the hospital. So that's really important. And Aware and Care is made possible by the Parkinsons Foundation and individuals like you. And so thank you for any support you have given them. And the Parkinsons Foundation makes life better for people with Parkinson's disease by improving care and advancing research toward a cure. And there you can see at the bottom, parkinsons.org, or if you'd like to call the helpline, it's 1-800-4PD-INFO. Please reach out to them. If you go to the website for Parkinson's Foundation, there are a ton of resources. There's tons of booklets, there's fact sheets, there's all sorts of things that are available for people, because oftentimes people often say that when they leave the neurologist after getting the diagnosis of Parkinson's, they're often stunned. Oftentimes their doctor doesn't necessarily give them a warm fuzzy and doesn't really share with them the resources that are available. It's kind of like, here's the diagnosis, you're on your own. And so there is help out there, whether it's Parkinson's Foundation or DAPS or Michael J. Fox, what have you. But the Parkinson's Foundation has been doing this a long time, and it has a lot of resources available. So please make use of them. Thank you.
Thank you, Marcie, for that really important and timely presentation. Does anyone have any questions? If so, they can put them in the Q&A feature, or they can also raise their hand.
And don't ask anything hard, because I may not know the answer. And if they would like to, if they would like a kit, like I said, if they're in the Dallas Metroplex, if they want to send information to you, or I guess I can put my email. I can't bring up the chat, but I can.
Yes, I did see they said, Marcie, please share your email and phone number.
Okay, I can do that. And like I said, if you're in the Dallas Metroplex, I'm happy, as long as I get all your contact information, I am happy to actually deliver it to you. If you're far away, I cannot do that. So.
Okay, we do have one.
Did that go okay? I sent it out. Hopefully everybody can see that.
Okay, so I see one raised hand. Okay. Hey, Joe, I allowed you to speak. Can you unmute yourself? There you go.
I sure can. Just a couple of comments, Marcie. I've had experience with when you've had a knee replacement, that they usually have a training class beforehand of what you can do or what you can't do. And I surfaced at that time about having Parkinson's. And so they told the whole class, which was good, of what they could use and what they couldn't use. So there's, that may be another vehicle of communication. The second thing I was going to mention is, and you know, I've mentioned this to you before, is 1 in 4 or 1 in 5 people that have Parkinson's also have low blood pressure, and that goes undetected. And when you're in the hospital, you're kind of anxiety, scared, and that makes it even worse. So it's important to do that.
Yeah, and that's the thing, you know, if you look at the list of PD symptoms, it's about 40 odd symptoms. And every single person doesn't have 40 symptoms, but has a mix of those. Mm-hmm. So that's why it is important. And in some of the information that's in here, that's one of the things you list that talks about your particular symptoms, so that you're hopefully making hospital staff very aware of what your needs are, not just in general. Right. So that's why I think it's important, because again, they just don't know what they don't know. And it's not something that they're necessarily dealing with all the time.
Absolutely.
And, you know, like I said, 1 million people sounds like a lot, but when you look at the whole United States, they're probably not dealing with many PD patients that often on a regular basis. So it's just a matter of just not knowing. It's not necessarily a matter of not caring or not wanting to do the right thing.
Marcie, one other thing is I wear medication tracker, which is the WebMD. And so all of my meds are on my medication tracker and when I'm supposed to take them. And so that's another avenue of making sure they know you have to have it at specific times.
Yeah. And let me be honest with you, with the Aware and Care Kit, as I said, 3 out of 4 people in the hospital are not getting it on time, or it's being omitted or whatever. They have found, even with the kit, often 1 to 2 are still not. Hospitals work the way hospitals work, and hospitals work what works best for them as a hospital.
Right.
So that's why I said a large part of what the ambassadors want to do is to try to get into hospitals to change the way they work. And the Parkinsons Foundation, to their credit, when you look at the electronic medical records that are kept in hospitals, one of the systems that is used is called Epic.
Yeah.
And Parkinson's Foundation has now gotten Epic to add information about Parkinson's, so that is asked, immediately comes up and everything else, and will bring up the drugs and all this other stuff. So they're trying to change that. And so they've managed to get a few things done, which have been done. And all it involves is for those hospitals' IT departments to upload the changes that they've made. So hopefully the IT department will actually do that across, but not every hospital uses Epic either. Right. So that's why it's important. If anybody has connections to hospital administrators, it's getting them to try to change it, because again, even with the kit, even when it's in front of them, there's still a possibility that they may not do it because it doesn't necessarily fit within their system. Becca, I did put my email and my phone number, but I'm not sure if I did it just to the person, if it came out just to the person who asked, or went to everybody.
I'm not sure. I would say, do you mind putting it in the chat function as well, just in case?
The thing is, I think because maybe I'm sharing my screen, the chat is not coming up.
If you want to stop sharing,
I guess I can stop sharing.
Yeah.
And then we'll see if it does. Yeah, now it did.
Okay, and then we have one other question. And that question is, do any hospitals allow care partners to give the PD person their meds?
Not usually. You can, basically what Parkinson's Foundation recommends is put the meds in your kit, okay? Sometimes hospitals will take your meds and they will distribute them to you to take. Sometimes they still will not even use yours. They will still get them from their pharmacy. But generally they will not let your caregiver or yourself just give you your meds, sadly to say. That is not usually what happens. But having them there makes it more likely that you're going to get the right medicine that you need, that's your medicine. Sure. So that's why, but often no, they do not. I mean, I get it. You're in the hospital and they're trying to maintain control.
Right.
So I get that, but,
And Angela, I saw that you raised your hand, so I invited you to talk. Do you want to unmute yourself?
Yeah, I didn't mean to press that button, but I do want to say, Marcie, that was a very good presentation. I'm a nurse and a geriatric care manager, aging life care professional, and I was not aware of everything that I've heard of the Parkinson's Foundation, but I was not aware of the Aware and Care campaign. So I feel like I have learned a lot today, and I just want to thank you for that. And I'm also going to see about getting you to do the same presentation for the National Aging Life Care Group, hopefully in the next couple months. You know, we usually have 1 or 2 webinars a month. And I feel like this would be really, really helpful because most of our clients are people with degenerative brain diseases, Alzheimer's, et cetera, the other dementias and Parkinson's. And so I've been doing this 14 years, and if I wasn't aware of all these wonderful things, then maybe others aren't either.
And that's what I was saying. It doesn't mean that they're bad doctors or nurses or anything. You just sometimes don't know what you don't know. And there's so many diseases out there.
Yeah. And I really liked your, you know, there's 1 million Americans with PD. It sounds like a lot, but when you spread it out over the country, you are so right. You know, people, and also, you know, treatments and information changes over time. And so, you know, and I know, and I'm sure this is a common phrase, but people, you know, have said, and I know that the Texas Health Resource Parkinson Center used to say, you know, if you know one person with Parkinson's, you know one person with Parkinson's, because everybody's unique in that way.
Exactly. And, you know, what I said, if you go through the symptoms of Parkinson's, it's like 40 odd symptoms or something. Well, probably no one's going to have all 40 symptoms, but every single person has their own array of them, so to speak.
It's kind of like COVID,
and they're different,
right? There's a million symptoms for that, but you're not going to have them all.
You're not going to have them all. So, you know, and so please reach out. I'd love to do the presentation because yes, it's mainly just about educating people. And again, it's not something with only 1 million. And I don't mean only, I'm one of those people. So I'm in no way making light of having Parkinson's. It's just when you have a population of like 350 million, the 1 million isn't that much. So that's all. But again, I have Parkinson's, so I'm not making light that it's no big deal or, you know, it's not important.
Well, and the other thing, I mean, Alzheimer's is up to about 5.5 million. So just in terms of comparison, you know.
And that's also why it gets a lot more money. For research and funding that research. So that's part of it too, but I would love to, so please reach out to me, and I'm happy that it was worthwhile.
Thank you.
Okay, does anyone have any other questions? You can put them in the chat, Q&A, or raise your hand. Of course, Marcie included her information in the chat, and if you have any other questions, you can contact us and we will make sure that we can also put you in touch with Marcie. So Marcie, do you have any final words?
No, just thank you everybody for listening. I appreciate it. And like I said, if you can spread the word, that helps immensely, because for PD patients, as most of you well know, if they are not getting their meds on time, that could be catastrophic in a variety of ways, cognitive and falling down and psychosis and all sorts of things. So there's no reason for a Parkinson's patient, whatever they're in the hospital for, to be going through even more than what they're in there for.
Right.
That could have readily been avoided. So, and again, if you would like a kit and you're in the Dallas Metroplex, I'm happy to get one to you, and I can do that for free because I do have them here at home.
Okay, thank you again, Marcie, for taking the time.
Well, thank you. I appreciate it.
Take care.
Have a great day, you guys.